Hi, well my name's Karen Williamson. I'm one of the obstetricians here at GROW. We're a group of 4 obstetricians and we're all women, we're all mums ourselves, and we love to look after women in pregnancy. There's 4 types of scans in pregnancy. One is the viability scans that are performed usually by us when we see you for that first obstetric visit. That's a scan to check that the baby's got a lovely heartbeat, and that's when sometimes miscarriage is diagnosed. And at that scan we also measure the size of the baby so we can accurately estimate the due date of the pregnancy. The second type of scan is an anatomy scan. So anatomy scans are performed at around about 13 weeks of pregnancy and again at 21 weeks of pregnancy. They're looking top to toe at the baby's anatomy to make sure everything's formed normally, nothing extra, nothing missing. And then the third type of scan is a growth scan. So that's in the 3rd trimester of pregnancy. We're making sure a baby is growing normally, that baby isn't too small and failing to grow or too large, which may cause problems with birth. And then the 4th type of scan are the fun scans. They're the scans we do in the rooms using machines like this when we see you for your standard visits through pregnancy. And they are scans that really help bond with the baby. So they're scans that are looking to check the baby's heartbeat, yes, but also to try and get that cute little picture that we can print out for you can take home, put on your fridge. Scans are really very comfortable. When people have a scan, a little bit of this gel is applied on the tummy, and then the ultrasound wand like this is placed on the tummy, and that gives us an image on the screen. Very occasionally we don't get a good view through the tummy, especially early on in pregnancy, and so sometimes an ultrasound wand like this is used inside the vagina, and it's just this bit here that goes inside, obviously with a protective coating on top as well. Sometimes at 16, 17 weeks when we do an ultrasound scan here in the rooms, if the baby's lying in the right position with their legs apart, we can get a good look at the genitals and tell you what the sex of the baby is at that point. And then even sometimes at the 13-week scan, at your formal scan at that point, can the sex be determined too. At that formal anatomy scan, when they're doing a top-to-toe survey, looking at the anatomy of the baby, seeing how everything is put together, occasionally an anomaly is discovered. Now, about 3% of all babies are born with some kind of anomaly. About half of these are minor things like a birthmark, but the other half are more complicated things such as a cleft lip or a hole in the heart or a club foot where the foot is rotated inwards. Now, ultrasound detects about 70% of all anomalies, so it doesn't see everything. It's a black and white image, so it doesn't see things like birthmarks. If there is an anomaly found on that scan, don't Google it, come and talk to us, your obstetrician, and we will talk you through what the next steps are, because not everything that's seen on an ultrasound scan that's reported as an anomaly is something that you need to be concerned about. If you come back to see us with a report that says an anomaly has been found, there are a few steps that we take. First of all, we ensure that a detailed scan has been performed over all parts of the anatomy of the baby to see whether this anomaly is isolated or whether it's part of a syndrome of multiple anomalies. We then also look to see if there's a cause behind it. For example, has there been an infection that the baby has suffered, or is there a chromosomal anomaly that explains this? And then we talk about a plan for the future. And this may involve talking to a pediatrician or a geneticist in the case of an anomaly. And then we help you make plans as to what the next steps need to be. Now, because ultrasound detects 70% of anomalies, not everything, we do a few checks on the baby after birth. We arrange for a pediatrician to come by your room after birth and to do a top-to-toe check of your baby. They'll do things like listen to the heart, listen for any murmurs, look in the eyes, check for any cataracts, and so on. Epworth also organises a hearing test for your baby, because that can't be detected on ultrasound either. So all babies at Epworth have a hearing test before going home.